Hello, good morning. My name is Susie Jenny, your aka Legit Queen, like my fans call me. If this is the first time of subscribing or watching me, please, you're welcome. Please subscribe to my channel and also follow me on my Facebook button for more healthy tips and more videos like this. Thank you very much for watching. Today we're going to talk about marijuana, the good side of marijuana and the bad side of marijuana, and why it is not legalized yet. Now, let's come to this. What is marijuana? Marijuana is a psychoactive drug from the cannabis plant. It is a native of the South Asia. For some call it weed, pot, dope, ash, grass, etc., etc. Why some people smoke it, some people vape it, some people drink it, or even chew it. Some even cook it, yes, with food. Yes. A whole lot of people use these drugs or this medicine, I would say, for pleasure or recreational purposes. A number of medical practitioners prescribe it for a specific medical conditions and symptom. This is something else. Okay, knowing that the effect of these drugs affects both the brain and the body. Now, why is it actually used? And it could actually be addictive anyway. Why is it actually used for this? I learned that some country actually legalize this marijuana known as cannabis. Some country actually like Canada, the US, and I think, yeah, some countries, a number of countries actually actually legalize the use of marijuana. Now, by the time you take this marijuana, you smoke it anyway, this marijuana will now go into your brain and stimulate the part of your brain that responds to pleasure and releases a chemical called dopamine, which makes you feel happy, feel relaxed. Sometimes you feel dull, but the way it reacts to a person differs. It reacts to people in different ways. It might react with me in a different way, and I react. It might make you aggressive. It might make you become a nuisance. I'm sorry for using that word, but that is what it is. Okay. So after taking this, you become um, um, something else, but people still legalize it. It means that it has a health benefit. Yes, I'm not trying to promote the use of drugs, abusing drugs. No, I'm not trying to promote the use of marijuana. I'm not trying to abuse it, but I'm trying to educate you about this for those people that are taking it and for those people that are about to take it. Okay, and for those people that doesn't know what this thing is, then after 3 hours of taking this, it clears. 1 or 3 hours of taking this, it clears from your eyes. Then you are back to normal. Now, the experience is not the same. My experience with marijuana is not the same experience with marijuana if you take marijuana. Now, what are the benefits of this marijuana that people tend to take? It actually says, according to research 2021, a research that was done 2021 by JCL Insights, it says that marijuana could actually lower the blood pressure. Yes, that marijuana could lower the blood pressure. Well, if that is true according to their research, well, it's a good. Another one says it reduces inflammation by Rockefeller Institute of Medical Research. It's a good one. Treating anxiety disorder. I think this is the main reason why people actually take this medicine or take these drugs. Yes, because some people do not want to be intimidated. Some people want to be like they want to be lord over everyone. It's someone that is more far bigger than you, and you're looking at the person like the person is a nothing to you. So I think that is why some people want to take this. They want to be, actually, that's a good one. But okay, so they said it fights against cancer, that it can prevent this cancer cell, cervical cancer cell. Wow. And also prevent relapse in drug and alcohol addiction. meaning it helps people who have the who are suffering from drugs and alcohol addiction. And it also have this tendency of treating gastrointestinal disorder. I don't know, but this is actually a recent research. This particular one that is actually a recent research, like gastrointestinal disorder, like the IBS, that's irritable bowel syndrome, yeah, and it also have the tendency of preventing seizure. That has a positive effect of treating epilepsy patient. That has a positive effect of reducing symptoms of seizure. Well, it's a good one. So you can see this marijuana is not as bad as people think it is. And it also has side effects. Of course, so many medication out there has side effects. So many drugs out there have side effects. Okay, but people still legalize it and make use of it for medical reasons. Okay, now what are the side effects of this marijuana? They said, want to know whether the side effect is outweighing or outweighing the, if it's outweighing the positive effects of, or the benefits of this thing. Want to know if it is, if the effect is better than the benefits. Let's see. Okay, they said it can cause fetus growth restriction for pregnant women, people who are pregnant that takes it. It will destroy, it will not make your fetus to grow. Your baby will not grow. That's restriction, growth restriction. Okay, that people who are driving may have people who are driving might be under the influence of marijuana, that are under the influence of marijuana can experience dangerous effects, maybe difficulty in reacting to the traffic signal or noise, or or even slow down. It's that one is a no, because it could actually lead to death. Yeah. So, and it also affects the brain health. It could cause permanent IQ loss, much as 8%. As much as 8%. Can you imagine that? If this drug could actually cause IQ loss of about 8 points, for about 8 points, is it still good for you to legalize it? Well, am I saying that the benefit is actually more than the side effect? But let's find out. So, it could actually affect your mental health. Yes, and it is addictive. It can actually damage your lungs. It decreases the testosterone level, testosterone production of a man, or it slows it down. The body produces testosterone for the man. It will slow it down. The body production of testosterone will slow down. Yeah, that's what I'm trying to say. Okay, so is this, you can see I've actually named, is as if the number, what I named from the benefits, what I mentioned from the benefits are almost the same amount, or the same number of what I mentioned from the effects. You see, they are almost the same. So why is it not legalized? I'm not saying you should legalize. This video is not to put you that you should legalize this. No. What I am saying is that I am trying to say that substance abuse is not healthy. If you're one of those people who are engaging or indulging in substance abuse, it is not healthy. One, why was it not legalized in where I come from, my country? Why was it not legalized? As of 2021, it was not legalized because some people came up, they said that taking these drugs often leads to crime and so many other things, conflict, war, and etc., the rest of it, So it could lead to crime, a kind of crime that is not, it's not, I don't know, it's not good. Yeah. And it plays a role about insecurity. And you see, the level of insecurity in where I come from is very, very, very not strong enough. So it is not healthy for us to legalize these drugs. Yes, I know it has a very much benefit. And nextly, they said our economy is very, 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 very not strong enough for that kind of luxury. that we do not have the luxury of allowing a nicotine economy. Yes, Canada have the luxury to afford this nicotine economy. From where I come from, the nicotine economy cannot work because we are very far from our infrastructure placement. We cannot, our placing of infrastructure right now is very, very far from us. We don't even have a very good infrastructure, medical infrastructure in our country. So where, if not, if we would have legalized it, our medical infrastructure is nothing to write home about. So imagine when you legalize this and there is no enough infrastructure or enough medical infrastructure to take care of this. A lot of people will be, or a lot of people will just go bunker out there. And it's already happening already when it is not already legalized. So when it is legalized, what would it look like? It will actually be a disaster. Yeah, it's going to be a disaster. So after all, yes, pharmaceutical opioid like codeine, refinol, tramadol, benzopam, a lot of them, they actually legalize it and they are controlled. They are controlled, but people still abuse it, and it's still causing a lot of problem already. It's a whole lot of problem and burden on us. So if you are living in a country where you cannot afford this luxury, because the way it is reacting to Mr. A is not the way it's going to react to Mr. B. So if you are in a country where you cannot, or they cannot, your country or your economy cannot afford this kind of luxury, nicotine economy, this kind of lifestyle, or this kind of medication, please do yourself a good deed by not involving yourself with substance abuse, because you are definitely one day going to run bunker. And if you run bunker, we'll throw you out the streets. And if you go out the streets, you're not going to be beneficial to the economy anymore or to us. So we do not want to have a lot of mad people out there, or mental ill health people out there. Thank you very much. Stay away from drug abuse, alcohol abuse, substance abuse, and whatever it is abuse. Do not abuse your health. Do not abuse yourself. Stay away from it. Stay tuned and watch more of my videos. I love you all. Bye-bye.